this point, I think I will be turning over already to our moderator, none other than Attorney Lorna Kapunan. Take it away, Lorna.
Good afternoon to everybody. Those of you who have just tuned in, you have just listened to the report of our chairperson of the Women's Business Council and to our president. Just so you get a brief background, Monette Hamlin, our chairperson, is the founder and chairperson of Team Asia, an award-winning 28-year-old integrated marketing communications firm. And likewise, Monette is chairperson of the Hopkins International Partners, Inc., and president of the Government Academic Industry Network, Inc., or GAIN. She was vice president of the Philippine Association of Convention and Exhibition Organizers and served for 3 consecutive terms in our Philippine Tourism Board. That is chairperson Monette Hamlin. President Mylene Abiva also speaks to you as president of the Women's Business Council. As you can see, we have a multitude of activities, and this is so because President Mylene she's a businesswoman. She's president and CEO of Felta Multimedia Inc., which is a 54-year-old company engaged in introducing innovative instructional materials and educational devices for school technology. And Felta is the education solution provider of Intel Education since 2012 and is Microsoft's gold partner. So you have heard from Chairperson Monette and President Mylene. Now we shall call, before I go to our panel discussion, we will of course have with us the very distinguished Dr. Esperanza Cabral, a very dear friend and my suki in my radio program, Saturdays, Laban para sa Karapatan. Dr. SP Cabral will be introduced by one of our trustees and forever treasurer of WomenbizPH, Evelyn Singson. Just because I'm introducing everybody, let me introduce Evelyn Singson. You know her as the feisty president of Dusit International. She was only the second female president of the male chauvinist, male-dominated MAP Management Association of the Philippines. And she also is chairperson and founder of ShareFil. But just a little trivia, Evelyn and Dr. S.B. Cabral are the best of friends. The third person in their triumvirate, and I used to call them when I was a young woman, well, I'm still young ones ngayon, was Senator Miriam Defensor Santiago. Together, they were a triumvirate of the 4 feistiest women I have ever known. So take it away, Evelyn, to introduce our guest speaker, Dr. Esperanza Cabral.
I thank you, Lorna. Yeah, we're still very young and younger. Anyway, it's true. SP is my friend, very good friend. Thank you, Dr. SP, one of our country's leading cardiologists and clinical pharmacologists, for accepting this invitation of Women's Business Council to speak on the topic, which is so apropos, yet so controversial and crucial in today's COVID milieu. Today's session, which we expect to clear the air and debunk fake news, will enable us to make informed choices when we are deciding to be or not to be vaccinated. Dr. Cabral, her public persona is very well known to us. She accepted her first government appointment as president of the Philippine Heart Center. Later on, she became our Secretary of Health. And during her stint in the department, Nari was there a tinge of scandal. Unlike recent times, when we hear a lot about questionable deals, like the Demaxia and Sinovac vaccines or expired medicines rotting in the warehouse of DOH, or PhilHealth's funds disappearing. Later on, Dr. Cabral was appointed as Secretary of the Department of Social Welfare and Development, more popularly known as the SWD. And under her watch, the 4Ps, or the Pantawid Pamilyang Pilipino Program, a human development initiative of the national government, saw its beginnings. The program provides conditional cash transfers or grants to the poorest of the poor to improve health, nutrition, and education of children aged 8 to 18. The 4Ps program received accolades from international aid organizations because it was so well run and the funds went to the intended beneficiaries and for the intended purpose. However, lately, it has become politicized and its credibility has been tarnished a bit. But behind the impressive CV of Dr. Cabral, she likewise excels as a practicing physician, as a wife and mother, and as a friend. Dr. SP, to her patients, is a caring and dedicated physician who truly looks after her patients as human beings and not as statistics. She is the ultimate professional, unquestionably trustworthy and humane. Her patients genuinely feel confident and assured that her diagnosis and treatment protocols are so dependable that they don't need to seek a second opinion from another doctor. As a wife and mom, I suggest you request to be her friend in Facebook because you will envy how her husband Bien is so supportive and proud of her advocacies and of her. And her children are her most ardent fans and loudest cheering squad, as she is theirs. And as a friend, and she has a multitude, Lorna and I among them, she is all you need to have. So ladies and gentlemen, our keynote speaker, Dr. S.P. Cabral.
Thank you very much, Evelyn. And you can tell that she is my friend. I am very happy to join all of you at this Women Business Council meeting and learning session to talk about something important to us. In the world, more than 110 million people have suffered from COVID-19 and almost 2.5 million are dead from it. In the United States, there are now more than 25 million infected with the virus and more than 500,000 dead as of yesterday. And in our country, the figures are 550,000 infected and 12,000 dead from the virus. And the virus is not finished with us yet. And as this crisis continues to unfold, one thing has become very clear. Our world has changed forever, and so have we. For the better or for the worse, it is really up to us. The question posed this afternoon, to be or not to be vaccinated, is very important. But maybe we should qualify the title to be or not to be vaccinated if ever the vaccine gets here. Next, please. Well, first, a disclosure. I am for vaccines. Next, please. As you can see, sometime in 2011, the Center for Disease Control in the United States listed the 10 great public health achievements of the 21st century. So that really means the first 10 years of the 21st century. And here it says that the control of vaccine-preventable diseases is the second of the 10 great public health achievements of the 21st century. But vaccines are achievements not just in the first 10 years of the 21st century. Next, please. Because it is the #1 medical advance in all of recorded history. The vaccines have been around for 200 years, more than 200 years, ever since a man named Jenner inoculated a lady with smallpox with cowpox serum. And from then, vaccines have gone to develop itself into the most life-saving medical advance in history. It has beaten anesthesia, the formation of the germ theory, medical imaging, the development of antibiotics, starting with penicillin, organ transplants, antiviral drugs, stem cell therapy, immunotherapy, and now artificial intelligence. None of these have topped vaccines as a medical advance. Next, please. Why are vaccines important to us? They are important to us because if there is a vaccine for a disease, it will prevent that severe disease and death from it. It will prevent symptomatic disease. And importantly, it will also prevent the transmission of disease to others. Next, please. Here is visual proof of the good that vaccines do. And this illustration tells us how the licensing and marketing of a vaccine has affected the number of cases of certain conditions such as rubella, mumps, hepatitis A, chickenpox, measles, pertussis, polio, and diphtheria. And if you take measles, for example, before the advent of the measles vaccines, millions of people developed measles and hundreds of thousands died from it in the world. When the measles vaccine came, you can see from this particular illustration that the number of cases of measles has gone down considerably. And in some instances, the incidence of measles is negligible in the world when the vaccination program is implemented properly. And that goes for all other vaccine preventable diseases. Next, please. Why else are vaccines important? Aside from protecting us, our loved ones, and our community from disease and death. And it is very important for us in this COVID pandemic, where our economy has suffered so much. The vaccines will enable us to reopen our society, and it will prevent our healthcare system from being overwhelmed and from neglecting the other non-COVID diseases that we all still suffer from, even as we suffer from COVID-19. Next, please. Let us take, for example, what has happened in a country where the vaccine for COVID-19 has already been implemented. So let us take Israel. Sometime in the beginning of February, about 55% of the citizens of Israel had already been vaccinated. And at this point, I think that number is approaching 70%. Next, please. This is what happened to the incidence of COVID-19 among the 60-year-old and above Israelis who were started on the vaccine. That is the red line. And you can see how the new hospitalizations for severe COVID-19 in the 60-year-old Israelis has gone down considerably after the vaccination program got started. The vaccine was 99% effective at preventing deaths and hospitalizations. The rate of COVID-19 infections declined by 96% among people who received both shots of the vaccine, and the vaccine was 98% effective in preventing infections that prompted the development of fever or breathing problems, the milder symptoms of COVID-19. Next, please. So it seems like the Philippines can really use a COVID vaccine. Okay, and this is how we are doing in the Philippines as far as COVID-19 is concerned. Uh, by September and October, the number of COVID cases started to decline and reached its lowest sometime in December and January. But since then, it has in fact gone up a little bit. And we think it is probably due to the December holidays as well as Chinese New Year and so forth and so on. Whatever it is, we are not doing a great job these days. Okay, so the decline in the number of confirmed COVID-19 cases has increased slightly, where we were hoping that it would actually go down to levels such as we saw maybe in the beginning of 2020. Next, please. Our case fatality rate, which is the number of people dying from COVID among those who got infected, was very good around September. From the time that we started measuring it, it had gone down to a low of 1.6 Filipinos with COVID dying out of every 100. But you can see from this graph that in fact, the case fatality rate has started to go up, so that now we are back where we were sometime in August, with more than 2 out of 100 people dying from COVID among those who are infected. Next, please. So given what the success of the vaccine in a country such as Israel has demonstrated, you would think that all of us would want to get a COVID vaccine. But that is not really how it is. There is a huge number of people who don't want to get the vaccine no matter what, and another even bigger number of people who are not sure whether they want it or not. So that's a lot of people who may not get the vaccine if everything was their decision. Next, please. This was not so sometime in 2015, and the study on how vaccine confidence has plummeted in the Philippines following the dengue vaccine scare tells us that in 2015, before the dengue vaccine controversy, 93% of people thought that vaccines were important. 82% of them thought vaccines are safe, and 82% of them thought vaccines are effective. Contrast that to 3 years later, when the dengue vaccine controversy developed, where only 32% of people felt that vaccines were important, only 21% of people felt that vaccines are safe, and only 22% of people felt vaccines are effective. Next, please. This loss of confidence on vaccines carried to this year, and now is affecting our vaccination program for COVID-19. In the last week of November and the first week of December, Pulse Asia conducted a survey. And in that survey, only 32% said they were willing to be vaccinated with a COVID vaccine. This result was borne out by the next research by the Okta Research Group about a couple of weeks after. And in this particular study, only 1 out of 4 were willing to be given the COVID-19 vaccine. Next, please. The latest study is a study by the UST COVAX program. It is an online survey on 15,600 respondents. And only 23.7% of them said they will definitely use any COVID vaccine available. 32% were probably going to use, 34% were unsure. Next, please. were worried about fake vaccines, about the safety of the vaccine, about the efficacy of the vaccine, about the efficacy of the vaccine against new variants, about the vaccines not being tested properly, about the high cost of vaccines, and about the vaccines having been made too quickly. So these are the things that worry them about the COVID vaccine. Next, please. Go back one slide, please. Okay. What did they want? They wanted the vaccine only after many other people have received it to see whether it was going to be safe and effective. They only wanted to be given the vaccine after politicians had received it. And when it came to where the vaccine comes from, they were most confident about vaccines coming from the United States and Europe. 3 out of 4 had confidence in these vaccines. They had less confidence in vaccines coming from Russia, and certainly very little confidence on vaccines coming from China. Next, please. As we can see, vaccine confidence is not only an issue of accurate and timely information, but of trust in the information giver. Okay, I could talk until I'm blue in the face, but if the person is not confident of what I'm saying, does not trust me to give them the accurate information, then vaccine confidence is not going to be regained. Next, please. Who is the person who is most trusted as a source of information on COVID-19 vaccine? This is a study in the United States, but I think it is applicable to the Philippines as well, okay? In the United States, the most trusted source of information on COVID-19 vaccine is the patient or the person's own doctor or healthcare provider. The Americans trust their healthcare provider more than they trust the Center for Disease Control, more than they trust their local public health department, more than they trust the Food and Drug Administration, even more than Dr. Anthony Fauci, and certainly much more than the President, Joe Biden, or the former President, President Trump. Next, please. So what must we do to get enough people to consent to vaccination, to reach herd immunity? Well, our communication strategy must address the concerns of those who are not vaccine confident or of those who are vaccine hesitant. And we must do this using trustworthy and trusted talking heads. We must use language that people can understand. We must give messages that are balanced and consistent. And we must give messages that inspire confidence. And really, because we all learn by repetition, the messages must be reiterated in all communication platforms widely. We have to fight through these communication strategies, complacency, skepticism, misinformation. We have to lead by example. And certainly after we have convinced people to get a vaccine, we must make vaccination convenient. Because if I go to a vaccination center and I get asked all sorts of questions and I'm given all sorts of delays, I may not come back to get the vaccine anymore if I have to do it for a second time. Next, please. So all of these things have to be done. We have to fight vaccine hesitancy, or else we are going to see a resurgence of COVID-19 and all of the economic consequences for loss of herd immunity. Next, please. Thank you very much. As my granddaughter says, be safe, ligtas ang praning. Thank you very much.
Thank you very, very much, Dr. SP. As usual, you have provided a very clear and understandable backdrop for our panel discussions this afternoon. But before I introduce our panel of speakers, let me just add a bit to what Dr. SPS said. First, the bad news, and she brings when she introduces the topic to be vaccinated or not be vaccinated, she has appended the phrase, where are the vaccines? And I think that is the question that we will all be asking in this afternoon's panel discussions, because we have read so many news about the controversy surrounding the purchase of vaccines and who are already authorized under the emergency use authorization. The breaking news we just got yesterday is now Sinovac has been given the emergency use authorization. The bad news, though, is apparently its efficacy is only about 50%, and even our Filipino frontliners refuse to be vaccinated with this vaccine. And among the controversies surrounding the purchase of vaccines is as Dr. Cabral has said, it depends on who is giving the information. We thought that February 14, we would get a Valentine's gift because our government spokespersons have said the vaccines will be here in time for Valentine's Day. Up to now, we haven't seen any trace of the vaccines. And as we are waiting for the vaccines, what is the government? This is the big question. What is the government doing in terms of prevention and care? Because during this hiatus, we cannot just stop. We cannot just stop whatever we are doing. So the bad news is last Saturday, we had the second highest recorded number of deaths. The highest being in September of last year, where we had 254 deaths. And as of Saturday, we have 239 deaths. And as an update to the figures, Dr. Cabral has said, we now have 564,868 confirmed cases, 522,941 recoveries, and 12,107 deaths, the highest in the region. So let me start this panel discussion by prefacing this with, no one is safe, let me quote, no one is safe until everyone is safe. And one death is one death too many. So our four panel of experts here, we will start with Dr. Susan Pineda Mercado, who joins us from Hawaii, Honolulu. Dr. Susan Pineda Mercado, Doc Susie, are you there? Again,
Yes.
is a young old friend. She used to be with us at the Philippine Red Cross. Is a medical doctor and a health expert with extensive experience at international, national, and local levels. Her international work includes a 15-year distinguished career at the World Health Organization, where she retired as Director of Non-Communicable Disease and Health through the Life Course approach. Dr. Susie is internationally recognized for her work on tobacco control, health promotion, healthy cities, reproductive health, family planning, and strategic health communication. She has also worked in the humanitarian sector with the International Federation of the Red Cross and Red Crescent Societies as strategic advisor for COVID-19. At the national level in the 90s, she served as Undersecretary and Chief and Staff of the Department of Health, Philippines, and recently was a board member of the expert panel for public health at the Philippines Health Insurance Corporation. Since 2018, Dr. Susie was designated with diplomatic status a special envoy of the president, our president, for Global Health Initiatives, currently Director of the Food Systems and Resiliency at the Hawaii's Institute of Public Health. As I said, joining us live from Hawaii, please welcome Dr. Susie, who will talk to us about battling the global war against COVID-19, among others. Take it away, Doc Susie.
Thank you very much, Attorney Lorna, and I'd just like to thank the organizers, Manette and Women Biz Philippines, for this opportunity to share some thoughts with you about COVID-19 vaccines. And I think Dr. Cabral has said it all. I will be giving you a perspective on this that is, I would say, a little bit more historical. And the title of my presentation is Battling the Global War Against COVID-19. Now, Sun Tzu, the Chinese philosopher, once said, if you know the enemy and know yourself, you need not fear the result of 100 battles. If you know yourself, but not the enemy, for every victory gained, you will also suffer a defeat. If you know neither the enemy nor yourself, you will succumb in every battle. And I'm opening with this statement because I'm going to talk about how vaccines help us know the enemy. And the enemy is a virus called SARS-CoV-2. Now, just a little bit of history. The SARS coronavirus showed its ugly head in 2003, 2004, coming from a mutation of a coronavirus from the civet cat, musang, in our language, musang. The civet cat is a delicacy in China. And coronaviruses are common to human beings. In fact, when we have the common cold, that is 20% of the time, that's the coronavirus. Cats, dogs, ducks, pigs, bats, all have coronavirus, including camels and including the civet cat. So when a virus from a wild animal, now there are maybe hundreds of thousands of viruses out there in the wild that human beings have never been in contact with. They may reside in animals, and where we have slaughtering of animals that live in the wild that may carry viruses that are unknown to human beings, these viruses can mutate. So a coronavirus of a human being can meet a coronavirus of a civet cat and create a big problem for human beings. So in the civet cat, it just causes a cold, but in human beings, it can cause death. So in short, the mutations among viruses that are in the wild or that are zoonotic, that come from animals, is really a problem for us because we don't know that enemy. We don't know these new viruses that come up. So the civet cat in 2003, 2004 was the source of the first SARS coronavirus epidemic. And at that time, it hit 37 countries with 8,000 people sick and 744 dead. And the fact that it affected 37 countries was cause for alarm. And at that time, we thought it was really a horrible thing that had happened. We saw what happened in Hong Kong, in Singapore, in Taiwan. And maybe we would have learned a lesson from that time, but I guess we forget easily. And in that particular case, that SARS coronavirus just disappeared. In 2012 and 2015, a new type of coronavirus was discovered, spreading in the Middle East. And it was called the Middle East Respiratory Syndrome coronavirus. Affected 27 countries, 2,000 people sick, 720 people dead. One of the countries that was hard hit by this MERS-CoV was the Republic of Korea. And this brought them to their knees. They had more than 100 deaths within a week at their most sophisticated hospital because they were caught with their guard down. And so they started preparing for a possible next pandemic. Now, fast forward to the present, which is COVID-19, which we also call, the virus is called SARS-CoV-2. 2019 to the present has affected 219 countries and territories around the world. Dr. Cabral has mentioned more than 110 million sick, 2.4 million have died. And the culprit in this case is the bat, a certain kind of bat found in China and consumed. So it's in the interaction of wild viruses, wild zoonotic viruses, wild viruses of animals with the human coronavirus that we see mutation that brings us to a point where we do not have any antibodies. So, our bodies are very sophisticated. We can fight any kind of illness. We fight cancers. We fight all kinds of allergies. Our bodies are great. But faced with an unknown enemy, if our bodies don't have knowledge of the enemy, then what happens is our immune system can go into overdrive. So in fact, what we learned from this pandemic was that it was not just the infection, not just pneumonia that got people, but it was rather cytokine storms and severe inflammation caused by reactions of our bodies because we are facing something that we do not recognize. I would say maybe an easy analogy would be like if a thief entered your home and you couldn't see it, that thief could take everyone away and even harm you because you don't know that enemy, you don't see it. And so it is very important that the human body has antibodies to SARS-CoV-2. Now, developing antibodies to SARS-CoV-2 can happen in two ways. You get the virus, and therefore you start developing antibodies, or you receive a small amount of the virus or a part of the virus or something that creates a part of the virus so that the human body can recognize it. And I think that part of the explanation has not been articulated as much as it should be articulated. There are only two things that are going to happen here. One is that you get COVID-19 or you get SARS-CoV infection, or two, you get a tiny bit of the virus or a part of the virus, and that will stimulate the development of antibodies so that you can fight back. You know the enemy, and so therefore you have a fighting chance. And this is all vaccination actually does. It helps you recognize the enemy so that if you get a natural exposure, your disease will not be moderate or even severe, and it will reduce or even prevent viral shedding and transmission. So we have to think about vaccination from that perspective, that because this is new and because we don't know, our bodies don't know this virus, dehado tayo eh. Parang hindi natin kayang lumaban kasi parang magnanakaw na hindi natin makita. Ngayon, pag tayo nabakunahan, nagiging liyamado tayo, right? We get a little bit of a dose of the virus, and therefore, we now know anong itsura ng magnanakaw na yon. In fact, it's like opening a light inside the house so that, I can see that virus and I'm going to kill that virus. So it is about strengthening your body's ability to fight back. Let us not forget what this war is about. This is a war between the human race and a virus that it does not recognize. Okay, and I'm going to, this is my last slide, and I'm sure, we've got distinguished speakers here. who are going to talk about the clinical part and the vaccines and all. But let me give you a bit of an idea of how infections are managed using a public health perspective. And this is because I also want to say that the vaccine helps us recognize and know the enemy. However, getting the vaccine does not immediately bring us to a point where we win the war. You know the enemy, right? But there will be battles, okay? So this is a sort of cascade of the public health approaches to different infections. And let me just say that we should not have the view that when we get the vaccine, we're going to immediately eradicate COVID-19 SARS-CoV-2. It will help us, it will prevent deaths, it will prevent transmission, but we will continue to need to wear masks, wash our hands, have social distance, physical distancing, and take precautions. Kasi malayo pa bago tayo dumating dun sa eradication. All right. So at the top, you will see there pandemic in black. And at the very bottom, you'll see eradication. I had the great, what should I say, opportunity or fortune to work with Secretary Johnny Flavier. So I was his executive assistant. I was in my early 30s at that time. And we were involved in the eradication of polio. At that time, polio campaigns had been going on for more than 20 years. But we had gotten to a point where we were about to eradicate the wild polio virus from the Philippines. And at that time, Manong Johnny was, campaigning. He went around the country. He said there was the 3 M's, right? The only 3 M's. Now, so I was his executive assistant. I had to handle his schedule, and people would get mad because he would say, lots of people wanted to talk to him. It was like a Pied Piper everywhere he went. But he said, no, the strategy is 3 M's. There are only 3 groups I'm going to talk to. Okay. Mayors, the 3 M's, mayors, midwives, and the media. And everywhere he went for this campaign, that's all he did. He met with these groups. And of course, people got upset because so many groups. Now, at that point in time, we vaccinated 9 million kids in 2 weekends. So it's possible. It can be done. And I believe there are people in the Department of Health who still remember this and know what it takes to make this happen. It was already devolved at that time. I think whatever the political conditions are, this can still be done. And we have muscle memory to do this. It can be done. At the time of Kwasi Romualdez, so that was the start of eradication. At the time of Kwasi Romualdez, I was chief of staff and undersecretary when polio, the Philippines was declared polio free. And that was another 10 years later. So it takes time to get to a point where you have eradication. Now, prior to eradication, there is what we call elimination control. So if you look at certain illnesses like tuberculosis, we talk about tuberculosis control because we still try to control it. It's there, okay? Certain infections like filariasis, we try to eliminate it through treatment. So there are several steps to get to a point where you don't have the virus anymore. And that requires a huge amount of vaccination. So what is the scenario? I think from pandemic, if we are successful in vaccinating huge parts of our populations in the world, then we will see an epidemic status in certain places, meaning it's higher than what might be an average. And then it moves down to becoming endemic. Now, the Philippines is endemic for many diseases. We're endemic for dengue, for example. Many countries in Africa are endemic for yellow fever. So in order to go to certain countries, you need a vaccine. So all of these things, to move from pandemic down to eradication, this requires vaccination. This requires teaching the human body to know the enemy and fight it. So I'd like to end here and just say that vaccination, as Dr. Cabral has mentioned, is probably one of the most powerful, important, and effective means of keeping the human race alive. And it's no different for SARS-CoV-2 or COVID-19. If we want to move from pandemic to epidemic status to endemic, which is this is the more likely scenario in the near term, right? Before we get to control or even elimination and eradication, we will have to vaccinate the population. So it is important. We need to do this, and we need to do it because our bodies need to know the enemy so that we can fight. Our bodies will fight the SARS-CoV-2 virus. Thank you very much.
Thank you very much, Dr. Susie Pineda. Those of you who are keeping score, you will now know that the score is 2 in favor of being vaccinated and question mark on our next 3 speakers. But Dr. Susie makes a very strong point. We are at war, and the enemy is COVID-19. And 2 things, you must know your enemy, which is COVID-19, but on top of that, you must know yourself. And knowing yourself means knowing your body and developing of antiviruses will strengthen our immune system. Dr. Susie also makes a strong case for vaccination, saying that it is the most powerful weapon we have to save the human race. Which reminds me of, at this point, of the 4 horsemen of the apocalypse, and I'd like to share it because right now we are fearing the future. The first horseman really is pestilence, and we have it now. But the second horseman was about hunger. And if we don't, sabi nga nila, pag hindi tayo namatay ng COVID, mamamatay tayo ng gutom, which makes a case for balancing, controlling the virus through precautionary measures of government and opening the economy. We shall hear about that from our next speakers. And of course, after hunger, there is death, which is the third horseman. And ultimately, the fourth horseman is war. Although already we are seeing the wars between the developing and developed countries, we are seeing the wars between the manufacturing companies, but hopefully all these wars will end in victory for humankind. So thank you, Dr. Susie. Those of you who have questions, and I can now see from our list of participants that we have over how many? 250 participants. Please send your questions to the chat group, or we are likewise live on Facebook and YouTube. Our secretariat is monitoring your questions. There are many questions I'm sure you'd like to ask, but reserve them for our panel discussion, question and answer later. Our next speaker is Marcelina Ace Itchon, our president and CEO and chairperson of the board of Aspen Philippines Inc. Aspen Philippines Inc. was set up by her from the ground up to become a leading pharmaceutical company in the Philippines. Ace, as we fondly call her, has extensive experience in driving organic as well as inorganic growth from acquisitions, new product innovations, introductions, line extensions, commercial alliances, and exclusive distribution partnerships. In 2018, she was awarded among one of the 20 most inspiring Filipina entrepreneurs. And apart from this, she has received many various awards. Among them, the most influential Filipino women in the world twice in 2015 and 2016. Yabang lang ako, kasama ko sa awards na yan. Ha? Ace is also a valued member of the Women's Business Council. So we have here this afternoon to talk about her company, health protocols in her pharmaceutical company. Please welcome Marceline A. Itchon.
Hi. Wait a moment because I lost my slides. Okay. All righty. A pleasant afternoon to everyone. I'm gonna upload lang my slides. Maylene, ayaw niya. Do you see my slide?
Yes.
Okay, good. Thank you. All right. Yes, good afternoon. A pleasant afternoon to everyone. I feel honored and privileged to be speaking before you today with a most esteemed roster of medical experts headed by Dr. S.P. Cabral, Dr. Susie Pineda, and Dr. Anthony Leachon, and Dr. Homer Lim, and a pride and delight as well to be sharing the virtual stage with my FWN sisters, Attorney Lorna Kapunan, and she's one of the trustees of Womenbiz Philippines, who's acting as the moderator, and the chairperson of Women Business Philippines, Monet Iturralde Hamlin, and Women Biz President, Sister Mylene Abiba. Thank you for having me here to present a case study on health protocols in a pharma company, and in this case, Aspen Philippines. It's an affiliate of the South African company Aspen Global, and incidentally, a leader in regional anesthesia in the Philippines now. This pandemic is arguably the largest game changer in modern times, affecting people from all walks of life and changing societies and cultures across the globe in an incredibly huge scope, depth, and breadth in terms of lost lives, lost jobs, lost businesses, shattered industries, and a plunging world economy. In the local setting, we see the government implementing quarantine measures in an effort to manage the situation. But as we also see, it has been a choice between health and economy as this tiny and terrible monster continues to plague our country, adversely affecting our lives and livelihoods. We have seen the lowest GDP plunge in years and a record high unemployment rate, with 27.3 million Filipinos declared jobless as of July 2020, at the start of this pandemic, and 50% of them losing their jobs during the first 3 months of the lockdowns. Towards the end of October 2020, this number miraculously went down to 3.2 million Filipinos jobless. 3.8 million Filipinos jobless towards the end of October 2020. And I think this is because our market gradually opens under GCQ and MGCQ. And since the second month of the local lockdown, the Philippine pharmaceutical industry has started to be severely impacted, registering the lowest growth rates in at least 5 years. Majority of the product types are down, except for viral vaccines, blood pressure medications, and over-the-counter products such as vitamins and minerals, which incidentally were the only ones growing during these times. So against the gloomy backdrop prevailing across the local setting and in the pharmaceutical industry, Aspen Philippines was not spared, but we chose to rise up to the challenges of the new normal, despite being negatively impacted by the crisis itself. Our response to this continuously evolving situation will be the focal point of this case study, which we shall be looking at in these 4 key areas. One, impact of the pandemic, which we have slightly touched in the first couple of slides. How Aspen protects its employees, how Aspen helps curb the spread of the virus, and how Aspen helps the community. Now we go to the impact of the pandemic. We have previously engaged employees in earthquake and fire drills, if most of you could remember, multiple times in recent years. But just like many companies, Aspen purchased supplies of emergency kits with first aid, flashlights, and all those things. We sent them to employees' homes, placed them under the tables in conference rooms, workstations, and in other strategic areas of the Aspen offices. But we were not prepared for a pandemic such as this one. No one was. The lockdown measures immediately affected the logistics of supplying goods and services, with severe bottlenecks that resulted to damaging effects on the business. Suddenly, the stocks of our medicines could not be transported to areas across the country where they are needed the most. Travel was restricted, and meetings needed new modalities of execution. Also, business continuity was at grave risk in the early months of the lockdown. As a young company operating in the Philippines for less than 10 years, our business continuity plan was then in its early process of completion. Documentation pa lang kami, and then, we suddenly have to activate it. But also, just like many companies, Aspen Philippines responded swiftly to the challenges that were rapidly arising from the disruption in our ways of working in the office and in the field, to the limitations in supply chain brought about by border closures in Italy, because some of our raw materials were coming from Italy, Germany, and these countries were closing their borders. And then also the need to immediately change the business processes. So we go now to how Aspen protects its employees. I'm not going to talk about vaccines because what we're doing at Aspen is also what we will do even if we are already vaccinated, if the vaccines arrive, if and when the vaccines arrive. Okay, so how Aspen protects employees. This pandemic is an excellent opportunity for us. We took it as an excellent opportunity for us to demonstrate value for people, to look beyond them as employees and see that they are mothers or fathers, husbands or wives, sons or daughters, brothers or sisters who have other people relying on them. So we took steps to support our associates and families as they adapted to new conditions and commitments, such as working remotely from home, educating children at home, the young mothers, and caring for loved ones. So the Aspen Philippines COVID-19 pandemic response plan was quickly organized and activated without delay so that we are not overtaken by COVID events. So, number one is hygiene products. Assistance was provided to the employees from the start of the quarantine. Hygiene products such as alcohol-based disinfectant and personal protective equipment such as face masks and face shields were delivered either to their doorsteps and or given as subsidies to the ones in provincial areas. A payroll subsidy as well for workers was the policy measure that was most needed at that time for the employees and their families to survive. We gave full salaries in advance part of the 13th month in the early days of the pandemic so that our employees can stock up on food just in case the lockdowns are prolonged. Even our security guards, janitors, and messengers were not left behind in the implementation of this payroll subsidies. The health condition of each employee is being monitored online. QR code is provided to those who are intermittently reporting to the office. Upon entering the building, our security performs temperature checks and offers alcohol or tissue. A helpline committee to address any matters arising from the pandemic was likewise convened to immediately respond to any report of any COVID-like symptom from any of our employees or their family. This helpline is directly under the supervision of our medical director. Healthy lifestyle and work-life balance were continuously emphasized and promoted as well. And through consultation and through our partner HMO, the employees can easily arrange for medical consultations with accredited healthcare professionals. And then we also launched programs to raise awareness and reinforce this by facilitating webinars and virtual lectures on COVID-19, its prevention and control, including sharing of work from home best practices.
Gusto mo yung libo-libo?
To me,
Kaya sa dibdib mo.
Pupunta sa ngalangan. Ubuhin ka.
do you hear what I hear? Okay. To me, one of the most important strategy that we had is employee engagement, because the COVID-19 pandemic has had major effects on our lives that can be stressful, overwhelming, and may cause strong emotions. 85 to 90% of our employees are millennials. And we do not know how they would react, to being isolated and, not being able to go out of the house. And some of these public actions made us feel, isolated, lonely, and this condition may increase stress and anxiety. So the need to increase mental and physical resilience of our employees was undoubtedly needed. Through all this, we supported our paramount strategy of keeping the employees safe with employee engagement programs through virtual town halls, small meetings every week, large conferences and cycle meetings, group chats in our favorite platform, fun contests, and thematic celebrations such as Mother's Day, Halloween, 5 days of Christmas, leading to the Aspen Christmas Party, kick-off conferences, and others. Keeping the employees connected has always been part of the strategy. COVID or no COVID, it is of vital importance. And to me, digitization is not the strategy, but only a tool to support the strategy of keeping everyone productively connected, hence promoting some sense of security during these uncertain times. And here are sample photos of our employee engagement initiatives and virtual celebrations, which keep the employees, which give them a sense of, belonging. Okay, next is how Aspen helps curb the spread. For the small teams alternately reporting to the office, we made our work environment adequately ventilated with strategically installed high-efficiency particulate air filters, or HEPA filters, HEPA in other words. So hand-washing soap and sanitizers are available for use of all employees, as it is mandatory and encouraged in all workplaces. Signages and visual cues and reminders to practice proper hygiene behaviors are well displayed. The minimum public health standard protocols are observed as well. Face masks, face shields are allocated and distributed to all employees. So on top of this, personal protective gowns are provided for supplemental protection. Physical distancing is observed at all times. We anticipated that the hospitals will be welcoming the medical representatives back soon enough. So part of preparing the field-based employees for this eventuality was the provision of 5 sets of PPEs, which now they use when they visit clinics and hospitals for work. And in order to reduce contact, we follow the restrictions on mass gatherings as defined by IATF. A minimal number of employees are allowed entry to the office 3 days a week, every first and second week of the month. No visitors or guests allowed, no, and also to further restrict contact among employees, video conferencing is employed even when we are in the office. For meetings that are needing large attendance or meetings that would last 15 minutes or longer. Eating alone in workstations is highly encouraged. The loneliest part of our office now is the pantry, because eating is not allowed. All employees are advised to conduct surface disinfection in their respective workstations before start of the shift, intermittently during shift, and at the end of the shift. Maintenance staff has actually a definite rotating schedule of surface disinfection before, during, and after working hours, and a general cleaning and disinfection day every Friday. And should there be a worker suspected of COVID-19, isolation and workplace decontamination protocols are in place. Here are some of the pictures showing adherence to health protocols, including wearing of PPEs even inside the office. Yan kami, ang lalayo. And then as the community quarantines started to ease, the monumental challenge of how to restart and run the business while ensuring the safety and well-being of employees was even more seriously considered. We have carefully thought about how our medical reps interact with healthcare professionals in an engaging and professional way. We've made our sales force use a variety of digital channels according to the health professionals' preferences, and we try to respect their time when doing so. In response to COVID-19, we have accelerated our digital transformation, again, not as a strategy in itself, but as a tool to support our connection and engagement strategy. It is definitely business unusual, so unusual, but with this, we hope to survive, thrive, and possibly grow the business back to pre-pandemic levels soonest, so that we can continue taking care of our employees. Of course, we need support, financial support as well, so that we can continue taking care of our employees, supporting the medical community and society and our other stakeholders. The last bullet in this case study is how ASPE helps the community. And by community, I mean community outside and the healthcare community. At the start of the pandemic, frontliners like doctors, nurses, and other paramedical personnel had to brave conditions to keep everybody else safe. I cried many times during the first few weeks of the pandemic because, doctors whom we know, doctors who were very close to us, they were dying just because they were unprotected. These men and women sacrificed family time and took on the challenge to their safety, faced discrimination, ignored hurtful comments that belittled their efforts. Tingnan nyo, nagiging emotional na naman ako. And struggled with lack of equipment just to enable all of us to stay home while they attend to COVID and non-COVID patients. In order to help ease their struggles, Aspen Philippines joined the rest of the country and many companies in donating what we can to protect our modern-day heroes. Despite the effect of the pandemic on our business and in the midst of limited supply of PPEs, face masks, and the scarce delivery services in the early weeks of this pandemic, Aspen was able to be one of the first to find ways to send hot meals to medical frontliners. My God, the only restaurant open during the first weeks was McDonald's, and they were only offering what's this small burger called? The small burger. Yun lang yung available at that time. And then we also were able to donate numerous gallons of alcohol and then aerosol boxes and various PPEs to different hospitals in the nation's capital. This is our way of sharing their burden during a most difficult period for them and for the country. Okay, sadly, the pandemic is not the only thing our country had to contend with. Natural disasters also struck us on an almost quarterly basis in 2020. The eruption of the volcano, onslaught of Typhoon Rolly and Ulysses gave us opportunity to reach out and lend a helping hand to affected employees and communities. Um, Relief goods and hygiene kits, most of which were personally donated and prepared by our employees, were shared with those who needed them. So aside from this, Aspen was also able to donate more than hundreds of thousands of one papers to seven public schools to help them sustain their efforts to shift from the old modality to the new modular distance learning method for this school year. All of these were conducted as Aspen also continuously faced business challenges and needed to make adjustments to the new ways of doing business at this time. This is our way of sharing their burden during their helpless moments. All this we do because Aspen cares. Thank you very much.
Thank you very much, Doctor. Thank you very much, dear Ace Ichon, for sharing with us your experience in pandemic response. Your pandemic response plan certainly is the gold standard for most big companies. But I guess what most of our participants would like to ask you later is, well, most of us do not have are not subsidiaries of big multinational companies. How can we afford to put your pandemic response plans that you have shared in place? And best practices really are good at this time of the pandemic. And as you emphasized, we have to address the mental and physical resilience of our employees. And we noted that 85% of your company employees are millennials, which really is a whole batch of problems when you deal with millennials and a sense of isolation and loneliness. And of course, we'd like to say thank you because you are blessed as a company and therefore you have shared your blessings with our frontliners and the community. So thank you for sharing your best practices with us. And there will be questions in the question and answer. Some have put in their questions in the chat group, but we shall wait for our panel discussion question and answer later. Our next speaker, we shall now go to our next speaker. Our next speaker, you have seen invariably many times in media. He is Dr. Anthony Lechon. He is the chairman of Kilusang Contra COVID, Kill COVID. He is a multi-awarded Filipino physician leader in preventive health education, and he is a health reform advocate. Dr. Lechon has extensive experience working in the corporate world as medical director of Unilever Philippines from 1993 to 1995 and medical and regulatory affairs director of Pfizer Philippines from 1995 to 2010. Among his many awards and recognition is he is an outstanding physician leader and health advocate, and he has been recognized for authoring Executive Order 595, otherwise known as the Health Education Reform Order, or HERO, as chair of the Advocacy Committee of the Philippine College of Physicians in 2007. HERO, which is Executive Order 595, remains the largest physician-led advocacy on comprehensive health education and disease prevention. Dr. Lechon also is a leading proponent of civil society in the passage of the landmark 2012 Sin Tax Bill for tobacco and alcohol, which is designed to curb smoking and alcohol illness and to earn additional 200 billion for the Department of Health and for PhilHealth. Sayang, nagastos na ng PhilHealth. itong pera na to. Most recently, Dr. Liachon served as special advisor to the National Task Force COVID-19, and he practices medicine as a leading internist and cardiologist at the Manila Doctors Hospital. Rumored to be the next Secretary of Health, maybe not by his friends, but by his enemies. Please welcome to share with us his insights, a dear friend also, Dr. Anthony Tony Lechon.
Thank you, Dr. Kapunan. Attorney Kapunan, by the way.
Attorney pa rin. Attorney pa lang.
I'm sorry. Can I ask the admin so that I can share my slides? I want to navigate my slides. While waiting, I'd like to thank the organizers. Nako.
Hi, Tony, this is Monette. May I ask Ace Ichon to please transfer host? You're currently the host.
Yeah, actually, I already gave up host role. I'm not sure why it's still with me.
3469041.
Can you still see my screen?
Okay, Felta is now host.
Yeah, Felta is host. Okay, all right, we're good.
All right.
Good.
There.
Thank you, Ace. Right. Okay, thank you.
There. Dr. Liachon is now the host. Sorry.
Okay.
Okay, thank you.
Share screen. Pati ko ma-share. Okay. Okay. I'm back. I'd like to first to thank the organizers, particularly Monette and Mylene, and I'd like to congratulate the other speakers, particularly Secretary Cabral, our mentor and colleague and inspiration to many. My dear friend Susie from Hawaii, good morning there ba, or good evening. And then Attorney Lorna Capulan, a colleague. And of course, Ace and Dr. Homer. And our esteemed colleagues, particularly the women biz. Now, before I start this particular presentation, I've noticed that I searched that most of the great leaders in the pandemic response are women. And I'm not sure about this, but you can see New Zealand, that's Jacinta Ardern. Germany, you have Angela Merkel, and then you have Taiwan, Chai Wen, and then Iceland, and then Finland, Norway, and Denmark. And the reasons put forward are the following. The first is truth. They are truth tellers. Second, they are very decisive. They use technology, and they use a lot of values like love, empathy, care, and sympathy and understanding. I'm not sure whether this is worth mentioning, but we're in a crowd right now dominated by women, and I hope that we can actually have those values with us so that we can actually end the pandemic. So my role this afternoon is to present to you what I think personally, this or perhaps discuss also the roadmap of the Philippines as to the vaccination plan. So I'd like to give, though in the beginning, Dr. Cabral about the global and the Philippine COVID data. Let's discuss a little bit of virus, then the variants in the vaccine, and the government's performance in my own personal view, and its impact on the economy, and the implications of the vaccination program of the country. So I had the greatest opportunity to work with military generals And 1 week after March 15, during the ECQ, I received a call from the palace that I was summoned to advise the chief implementer, that Secretary Galvez. And I had the great moments in my life to work with military generals who are great strategists, great gentlemen. On my left is Secretary of the DILG, Secretary Ed Año, who's my good friend. The good gentleman in the middle is Secretary of National Defense, Delphin Lorenzana. And of course, the chief implementer, my boss, Secretary Chargil Galvez, is also the vaccine czar at this point. Now, this is the global picture, and I'd like to summarize that there are about 100, 11 million global cases. And the number one on the list is the United States with about 28 million, followed by India, Brazil, United Kingdom, and Russia. And then the total number of deaths staggering 2.5 million. And case fatality rate is about 4%. So you can see here the magnitude of the problem that we are facing right now. Now, prior to this discussion, I'd like to give you a summary of what we have. And I posted this actually on Twitter and Facebook, and this was just 2 months ago. I made this particular analysis a day before the IATF, or 2 days before, and why I am not yet convinced that we should shift from GCQ to the modified GCQ. Well, the cases right now would average 1,800 to 2,000 per day, and the deaths increasing by the day, the last 7 days, and that's yesterday. That's about 2,088. I think we have about 1,800 today, and the case fatality rate is increasing too. That's the number of deaths over the number of cases, and we have about 2.14%. The reproduction number, siguro alam niyo na ito based on the Octa. When it is more than 1, it means more transmission and more contagious. It's 1.22 for the National Capital Region. Incidentally, this would be the business epicenter of the country. We have a new threat, the UKB 117, and 2 mutations of concerns in Cebu City. The vaccines are not yet available and without definite timeline on its rollout, though we have 3 already approved by the FDA. That's Pfizer, Astra, and then 2 days ago, Sinovac. And then there's an increase in the positivity rate. The daily positivity rate is around 6.8%. The WHO benchmark is about less than 5%. Today, it's about 7.5% as reported by the Department of Health. So this was yesterday, right? So this was shown by Secretary Cabral. So this is just the story. We had index cases, a few index cases before. And then, as you can see here, we had a long lockdown from March until June. And then, because of the lockdown, we loosened up on the restrictions, and we had a peak about 7,000 cases sometime in August. And this was the time when the medical community, led by the HPAAC, some good friends there, Dr. Tony Dance, Dr. Spina, Dr. Onglin, and some of the medical societies requested for an ECQ, remember that? And then the president actually granted MECQ, and then that resulted to a downward trajectory to 6,000, 5,000. And then we have here right now, we have not flattened the curve, and we're still hovering in the 1,000 to 800 at this point in time. So we have almost 500,000 cases at present. Now, after my, so I was ousted of the National Task Force after the visit in Cebu, basically because at that time we thought that the Department of Health regional data was not transparent enough, because we heard and we received texts and other messages coming from doctors from Cebu na halos pulo yung hospital. So we went there together with Secretary Galvez and Secretary Vince Dizon. Secretary Galvez met with the political leaders and the business leaders. Kami naman with Secretary Vince Dizon and Dr. Ted Herbosa, and Dr. Bueno met with the medical directors of the hospitals. And to our great surprise, puno na halos yung hospitals eh. And I tweeted this in terms of transparency, sense of urgency. So, madalit sabi, I was asked to resign. But after that, 1 week after, General Simato was actually designated, ginawang ECQ ang Cebu, if you remember. And then for a month or so, nagkaroon siya ng ECQ. So after that, I went on public work. I'm actually the head of a multi-sectoral organization, the Private Society Group, doing some advisory work to Mayor Joy Belmonte, sometimes with Mayor Isko, sometimes with Mayor Toby, sometimes with Mayor Benji Magalo. Now, let's now go to the heart of the matter. How do the COVID-19 vaccines work? And it's simple. It's basically you want to trigger an immune response by producing antibodies to destroy the COVID. So basically ito yung prinsipyo ng vaccine. And if you remember, it was on December 8 last year when a 91-year-old grandma from UK, Margaret Keenan, she will go down in history as the first recipient of the vaccine, the Pfizer, by a Filipino nurse working with the Ministry of Health, the National Health System of London. That's May Parsons. And as we can see, vaccines will help your body to make the antibody that will destroy the SARS-CoV-2. And hindi lang siya, no? That's to make a point is that it was also given to Queen Elizabeth at age 94, to Prince Philip, the Duke of Edinburgh. It was given also to Pope Francis and Pope Benedict, and a lot of personalities. No? So ang age bracket niya would actually be ranging from 18 and above, given this particular vaccine. Now, which vaccines are available right now in the market? Okay, so I think this would be important. Now, we have here Pfizer from the United States and Moderna. So Pfizer is the #1 American company. It's 95%. As a disclosure, I used to work there. I retired in 2010 after the death of my sister, and worked with Secretary On as a one-peso consultant. And then you have Moderna, a startup company, 94.5%. And then coming soon will be Novamax. And then you have this particular vaccine, the AstraZeneca. Most of the LGUs ang in order yung AstraZeneca with an efficacy rate of 62 to 90%. And then you have here Johnson & Johnson's, that's Janssen. And then you have 2 Chinese vaccines, that's Sinopharm and then Sinovac. And then the Russian vaccine, that's Gamaleya Sputnik. And then one from Australia, that's Clover. What we have in the Philippines right now, as approved by the FDA, are the following. You have Pfizer, #1, #2, Astra, and Sinovac. Now, let me give you a comparative chart of the current vaccines in the market. So we have the Pfizer, which is the first one, registered and approved by EUA. That was on December 10, and then followed by Moderna on December 17. They actually use a different platform, RNA synthetic version, right? And then followed by Astra using a viral vector. So all of the, in this chart, all of them are given in 2 doses. One, first dose, and then after that, it will be given after 4 weeks. And then I think for Astra, you can actually give this after up to about 3 months, no? So ito yung contention right now because of the tight global chain or supply. Tinitingnan natin whether we can give the whole dose and the second at a later date, no? And you can see here the efficacy, 62 to 90%. Quite unique. I'd like to explain this, no? When they use the full dose, 90% efficacy rate. But through a manufacturing error, according to the CEO, when they use pala full dose 62%, but when they use the half dose and and the full dose 90% efficacy rate. Now take note that Pfizer is the only one that would need a sub-zero negative 70 degrees, but 2 days ago they applied for a preparation that would actually be simulating yung Moderna, and hopefully it will be coming sometime in October. So hindi tayo mangangailangan ng mga cold chain infrastructure if ever we will use the Pfizer BioNTech. And then the Sputnik 92% na-release na to in a peer-reviewed journal. So once it's published in peer-reviewed journal, we have to believe, no? Kasi na-review ng mga experts ito. And that is very important in the submission of the regulatory documents to the FDA. Now, let's go to something na pending pa. You have the Novamax. I think United Lab will be carrying this. Again, 2 doses with regular fridge. Janssen, this will be innovative because single dose lang siya. Kasi the challenge for the LGU is to ask the patient to come back for the second dose, no? So this would be very, very exciting. But it may not be coming our way in the next 3 months because we have a clinical trial ongoing right now in the Philippines. So my projection, it may be coming sometime in September or October. And it's a good thing that regular fridge lang siya. Now let's go now to the Chinese vaccines. Sinovac has actually 3 efficacy rate. 50% from the Brazil study in which they use it in healthcare workers. And then you have something like 91% in Turkey and 66% in Indonesia. So variable, no? And then the Sinopharm, right now, I think they're also applying for EUA a 79% efficacy rate. No? So just to summarize, Pfizer 95, Moderna 94, Astra 62 to 90%, and then Sinopharm 79, and Sinovac 50 to I think 91%. Now, this was the use. This was the use 2 days ago. The FDA granted emergency approval for Sinovac. Now, let me explain emergency utilization approval. Ang ibig sabihin po nun, approval niyan for 21 days. And ang phase 3 trial usually would run from 2 to 3 years. And the certificate of product registration, yun ang permanent yun. You can get that. And then for market authorization. Meaning to say, the private sector and the LGU, pwede mo na siyang bilhin kung sarili mo. But since the government needs it, hindi mo na mahihintay ang clinical trial, then you have to do emergency utilization approval. And that's the reason for indemnification, to protect the drug manufacturers kasi evolving ang science and the safety profile of the patient. So that was used actually in the United Kingdom when they first negotiated with Pfizer in September and then December. Now, a big issue yesterday is about the dichotomy of giving the medication. Hindi siya pwede for healthcare workers and for senior citizen because they think that the efficacy rate of 50 may be lower, and since they're vulnerable, this would be given to healthy individuals aged 18 to 59. So our challenge right now is to communicate to the public on how to give this. But if I would expound a little bit, ang requirement lang naman ng WHO and even FDA is just a 50% efficacy rate. Sinuwerte lang tayo that we got a 95%, 94, 92 in some of the vaccines na nakuha natin. But 50% is okay. Now, this one is something na naging issue, no? Ibig sabihin pala ng TLDR is too long to read, yun ang ibig pala sabihin nun. So Sinovac has been approved for emergency use in the Philippines, but not for healthcare workers, senior citizens above 60, but from 18 to 59. Ang senior citizen in the country is about 7 million, for your information, and 50% of the population natin is less than 25, and 26 to 59 is about 43%. Now, I think the greatest educational measure that we can do is to show the country that you are, amenable to in a public display. No, katulad ni Joe Biden, this was taken December 21, 2020. But for Sinovac, yun ang meron tayo. It may not be given to the president because the president is above 60, or even for Secretary Duque. And perhaps the IATF, less than 60 years old, would be willing so that you can actually increase the vaccine acceptability. It was given to the Singaporean Prime Minister, Prime Minister Lee, sometime in January. A few days ago, the Prime Minister of Australia, Scott Morrison, Australia has started with the mass vaccination as well. And this was discussed by Secretary Cabral. Ang pinaka-successful right now in terms of the vaccination, almost 40 to 50% of the population ay nabakunahan na because they are hardworking, 24/7. And this is Benjamin Netanyahu. A little story, kasi binabasa ko yung Twitter, is that I think Albert Bourla, who's the CEO of Pfizer, is a friend of the Prime Minister. And I think merong Jew blood or Israeli blood ang si Albert Bourla from CEO. Kaya continuous yung supply nila. But as you can see, ang ganda ng results, no? This was shown by Secretary Cabral, but I just like to put it in one slide. So as you can see, December 2020, no? And then these are the results after 2 months. You have almost above 90%. 7 days from dose and 14 days in preventing COVID infection, preventing disease with fever or respiratory symptoms, preventing COVID-19 hospital admissions, preventing serious disease or COVID-19, and preventing COVID-19 death. Look at this fantastic data. So as you can see, kung nak-start na kagad natin ang bakuna natin, sana natuloy this January, no? We could have gotten the dose sometime in January, then we could have the herd immunity in about 3 or 6 months. Then okay na tayo before the son of the president. But we should start as soon as possible so that we can still have the herd immunity and open the economy right away. Now, this one is a beautiful slide showing that those countries who fare relatively well in ending the pandemic would have a very good economy. And this would be Vietnam, China, and then South Korea, then Japan, no, New Zealand, no. But those countries that did not perform in terms of their pandemic response, makikita mo may problema. That's US, Brazil, UK, no? And the presidents of these countries contracted COVID. That's Donald Trump, and then the Brazilian president, and then Boris Johnson. So, ganun ang concept eh. It's mostly about their approach to the pandemic, and therefore, you can control the pandemic and then reopen the economy. And usually in Southeast Asia, because of the hammer and dance concept, most of the countries in Southeast Asia, na-control nila yung pandemic in about 3 months' time, using science, of course, and not lockdown. Kasi we have the longest lockdown in the world at this point in time. Now, ito yung highest vaccine priority for the Philippines. Our first priority will be the frontline healthcare workers. All right? And I think PG8 sana yun, last February 15. And the first recipient is our good friend, Secretary Cabral, Jonas De Losario, the spokesperson of the PG8s. Both parents died, by the way, at PG8s. Kaya I think very emotional si Dr. Jonas De Losario about this. And then the second priority will be senior citizen, the indigent senior citizens and the remaining senior citizens. And then the third priority, that's 12% of the population, will be the remaining indigent population. And then the fourth priority will be the essential workers outside of health and education. So ganito po ang herd immunity, no? Lagi nating naririnig siya, no? So for example, you have the virus here, no? Now, if you have a 25% of the population na nabakunahan, mababawasan po yung infection. And as you actually progress from 50%, ito na lang po yun. Ang infected, magiging konti until you have almost 95% of the population. So at 75%, ito yung target natin. But if you could target, let's say, almost 100% of the population with the vaccination, ang ganda-ganda po nun. So this is our target. And herd immunity will prevent viral transmission. You cannot do herd immunity without vaccination. Ito yung ginawa ng Sweden. Almost suicide sila. Nagkaroon sila ng highest death rate among the Nordic countries. So you cannot do that without vaccination. Now, look at the United States, no? Because of the catch-up time, because of Joe Biden's advisory group, using the 12-month medical advisory group, their projected herd immunity will be reached by July 19. Now, bakit ko pinoproject to? Because the supplies ng Pfizer and Moderna will be given to the rest of the world kung maaga magkakaroon ng herd immunity. Kasi they started, remember, December 10 and December 19. And ang projection natin is 6 months for the herd immunity. Ngayon, mapi-free up ngayon yung mundo. And hopefully, if we will get the vaccines, ang projection ko, working in the industry kasi, you need about 150 days bago makagawa po tayo ng bakuna. Alam po ni Secretary Cabral yan, alam po ng mga nagtrabaho sa industriya, na you need about almost 6 months. Pagka nagkaroon ka ng certificate of product registration in the United States, you need about 6 months. So, ganun po yun. So, let's say Pfizer, nagkaroon tayo ng EUA sometime in January, we expect na yung bakuna natin dadating ho ng July. And same thing ho with Astra. Ganun ho ang projections natin. Now, if this will be true, and then ang sona ng President will be on the last Monday of July, hopefully by December, we can have a Merry Christmas kung darating ang mga bakuna natin based on the timelines. No? Now, this one is a nice slide telling us na yung mga nagpareserba, hinahanap ko yung Philippines eh. I was looking for the Philippines here. Look at the successful countries. No? It's about strategic planning eh. Sorry po by saying this, hindi tayo kagad ng queue up eh, earlier eh. Kasi ang style po dyan, working in the industry, usually nakikita na namin, Dr. Cabral used to work also in the industry. Alam po ni Secretary Cabral na usually 5 years in the making, alam na ho natin yan. So therefore, paglabas ho ng phase 2 trial na yan, you have to put your bet right away. You cannot just wait for the vaccine kasi mag-uunahan yan eh. And look at Vietnam, China, and India, and South Korea. These are successful countries eh. Now, ang problem natin is how to actually increase yung acceptability ng Filipinos. And this was mentioned, yung mga reasons ni Secretary Cabral, the Deng Bakso story, the safety concern, a lot of things, no? And this will be the challenge for the Philippines. Now, the COVID-19 vaccination program will be the largest and the most complex public health effort in history of the Philippines. So execution is key, and it will especially benefit the poor and the most vulnerable among us, particularly the healthcare workers and the senior citizens, and those with comorbid conditions like hypertension and diabetes. Now, you have to vaccinate about 70 to 75 the population in the Philippines. The other explanation pala, I'd like to explain, kaya ang hirap natin i-flatten ng curve kasi archipelago yung setting natin, like Indonesia. Unlike other countries na single lang yung entry nila or landlocked area sila, once you control the entire country or region, okay na. But you see, we have several hotspots eh. NCR, then you have Cebu, then you have Davao, then you have Iloilo, and then you have Northern Luzon. So social mobility is an important factor in COVID transmission. So we will have to vaccinate most of them twice within a month unless dumating yung Johnson and Johnson. And today, around 40% of Filipinos say that they're not sure if they will be vaccinated against COVID-19. Sa PGH setting, I think with Gap Legaspi, ang una nilang survey, the acceptability of the healthcare workers was 75%. But when they found out that it would be Pfizer, naging 95%. So, even the 15,000 online survey by UST, by Father Nick Ostrarco, ganun din ang sinasabi. So, it's the choice of the vaccine. And I'm glad that there are 3 vaccines right now that the Filipinos can choose from. Now, this one is a provocative, idea, something novel, something new. That eventually, ang future, ang tingin ko, people will get this COVID vaccine para may immunity passports ka. And this is important to economic recovery, and that's why we need to have vaccination. The Philippines will be isolated from the rest of the world if we will not be vaccinated. The tourists will hesitate to come. The international business people will not travel. Filipinos might not be given passes or visas to travel abroad, thus curtailing the business activities and even family and leisure travels. Our competitiveness will sink even further in rankings. Imagine Bangladesh, Nepal, Sri Lanka, even Zimbabwe, and even Pakistan are vaccinating right now. So, nahuhuli na ho tayo ng konti, and a sense of urgency is really needed at this point in time. Ang enormous challenge lang natin, and sadly, the Philippines ranks lowest in the government COVID response among Asian countries. Whether we believe it or not, it was mentioned by a Singaporean agency. We have the worst economic performance since World War II, and that is sad. And that's a strong point for vaccination and of course having herd immunity. We're right now at the lowest in terms of our performance, in terms of our GDP. And this was presented by the DTI Secretary and the NEDA Secretary. And according to Secretary Ramon Lopez, without vaccination, the Philippines would be the last among the countries in terms of economic recovery. So the rate limiting step, ladies and gentlemen, is basically the vaccination rollout. Now, for those countries na nag-apply ng science, tingnan niyo po ang success. Look at New Zealand at the top and look at the bottom. So New Zealand, China, draconian measures. At the bottom, New Zealand, Brazil, and Britain. Anong commonality? I mentioned the presidents of these countries contracted COVID virus. So very, very important that we enlist a lot of public health experts, epidemiologists, data analytics, former secretaries of health, academicians, men of science ang kailangan natin. I have nothing against, of course, by former bosses, military generals, because they're great tacticians, but they need, of course, medical support. No? Day in and day out. Ibig sabihin, pang araw-araw, hindi lang yung, let's say, you have a vaccine expert panel. Dapat katabi nila yon because you will have to make that decision right away. And that particular decision is important for policy making. Now, we need to recognize the problem, and there's a big elephant in the room syndrome. The big elephant is that nakikita mo may problema pero hindi natin siya tinitingnan. No, na vaccination pala importante. Or nandyan lang siya, hindi natin pinapansin. But this is my personal opinion. The economy will never recover as long as the virus is not controlled. And if you don't understand that, then we're part of the problem. So makikita nyo several IATF guidelines vetoed by the president from the 10 to 15, remember, na gustong pumunta sa mall, that was vetoed when the Philippine Pediatric Society ay nagsalita. And then the last one, yung 2 days ago, when he retain yung GCQ muna in some of the key cities without the vaccine rollout. Now, sa akin, priority kasi yan eh. Health is the first wealth eh. And by vaccination, we can actually maintain yung health natin towards the economic recovery. Now, I'm down to my last 3 slides. And this is one important slide that I'd like to tell you. And this is from the World Health Organization. We can only lift the restrictions if the transmission is controlled. So at this point in time, hindi controlled. The healthcare system capacities are in place, like testing, contact tracing, isolate. But not all LGU merong mga molecular labs or testing or contact tracings. Outbreak risks are minimized in special setting like health facilities and nursing homes. Preventive measures are in place in workplaces. Yes, I think. But ang schools hindi pa. Ang face-to-face hindi pa. Because of the lack of vaccination. We have to manage importation risk kasi dito nanggagaling yung B117. But we have opened the borders again. And the B117 is actually a dangerous type of variant. We have 5 variants right now. You have the old Wuhan, and then you have the 614, and then you have the UK variant, the 117, and then you have the 1351, that's a South African variant, and then you have the Brazil variant. Manggagaling lang yan coming from travelers with those in countries with these particular variants. Now, I think we have done our share. Walang tatalo sa Pilipino in terms of complying. No? Kukunti lang siguro. I think the communities right now are fully educated, engaged, and empowered no? With the health protocols being implemented by the LGU. I'd like to share this wonderful slide from Ian McKay from Australia, that we have personal responsibilities and shared responsibilities. And each intervention, kaya siya parang Swiss cheese. And because each intervention has imperfections. And therefore, multiple layers would improve the success. Like yung physical distancing, mask, hand hygiene, touching, crowding place. But ang shared responsibility, once na nagkaroon ka ng symptoms, you have to be tested and you have to do contact tracings. You have to, provide ventilation. And government messaging is important right now. Ang problema natin, ang dami pong nagsasalita sa atin. And therefore, nag-iiba-iba rin po yung interpretation of the public. And then quarantine and isolation, should be a must for every LGU. And the last piece in this strategy is actually the vaccines, so that we can actually live in the new normal or back to our old self. Now, hindi porke nabakunahan na, according to Dr. Susie, okay na tayo. We should maintain our healthcare capacities. And we should actually invest pa in healthcare, hindi lang sa healthcare natin, so that we can prepare also for the next pandemic. And for many decades, being an advocate with Secretary Cabral and Susie and then Tony Dance, alam natin na pabayaan natin ang healthcare workers natin. And imagine nyo, in the midst of this pandemic, umaalis sila just to see greener pasture. And we cannot prevent them from leaving. And then, to the point na nalungkot ako this morning, ang balita for Germany and UK, in exchange of vaccines, we will exchange them for nurses. Medyo masakit sa kalooban natin. But what can we do at this point in time? And then we need to have several infrastructures all over the country. Hindi lang PGH. Lahat kasi pupunta lahat sa PGH. If every region would have a mini PGH from region 1 up to region 14. So you can deploy right now healthcare workers, ayusin natin ang PhilHealth, and then economy will be okay in that particular region. Now, this is my last slide. In conclusion, it's a blessing from the Lord. It's the best in the worst of time. It's the worst of time dahil meron tayong pandemic. But it is the best of time because we have you. Ang dami nagke-care for this country, right? And we have efficacious vaccines na. But we should all be vaccinated not only to protect ourselves, but also to protect our neighbors, especially those who are elderly and vulnerable. Number 3, with vaccination of the 70% of the population, we will achieve herd immunity. And with herd immunity, we will be able to reopen the economy and bring back our lives to normalcy. And my slide, my favorite is of course Albus Dumbledore from Harry Potter. And he says, happiness can be found even in the darkest of times if one only remembers to turn on the light. Thank you very much for your kind attention. Maraming salamat po.